So good afternoon, everyone. And I'm really happy to open this session on Simeox physiotherapy. And my co-chair is Paul McCallion. I hope he'll be here soon. We have three talks in this session. First, Laurent Morin from France to describe the technology, and then clinical experience sharing and live demonstration on patients, and we'll have a short questions and answers time. So, Laurent, please, the stage is yours.
Thank you. So thank you for the organizer to give us the opportunity to talk about Simeox therapy. Unfortunately, Paul McCallion is sick and was not able to come to the conference. So I would like briefly to introduce the principles of Simeox technology and clinical evidences. The first clinical evidences we have in patients with non-cystic fibrosis bronchiectasis. And this is the agenda. So as you know perfectly, mucus clearance is a key component of the management of these patients, especially the patients with chronic mucus hypersecretions. But very often, the patients feel the airway clearance therapy as tiring, burdensome, benefits are not so very clear. And we see, especially in registry, a dramatic reduction of adherence with less than 50% of patients that continue to use airway clearance therapy after 1 year. So it's not bad. It's very bad data for adherence of airway clearance therapy, and that's why Simeox airway clearance technology was designed to help the patients to be treated at home. And the device is based on the rheological property of mucus. You know, the mucus has capability to liquefy very fast in less than 2 seconds when it is exposed to a specific mechanical stimulus. And when the stimulus stops, the mucus recovers in its state. So during this transient change of mucus structure, the secretions can be mobilized much more easily, and when the mucus is stimulated with a under a specific signal. So Simeox delivers a precise oscillatory pneumatic signal that aims to liquefy the bronchial mucus, and in the meantime to facilitate progressive mobilization of secretion from the most peripheral airways to proximal airways, and to be naturally expectorated afterwards. So you can see in this video that the patients inhales normally a tidal volume of air to homogenize the air inside his lungs and to bring air behind the secretions. And when he's ready to exhale, he activates the device, and a successive intermittent series of negative air pressure pulses are activated 12 times per second. And the device is capturing a small volume of air. And as the volume of air decreases inside the lungs, the amplitude of these intermittent pulses are growing, and these pulses create a vibratory oscillatory signal that liquefy the mucus and mobilize the mucus, transport the mucus from the distal airways to proximal airways. So we have performed a bench test with mechanical lung evaluation to compare the safety and efficacy of Simeox with PhysioAssist and the vest. And the data showed that Simeox generates a more efficient flow bias and compared to other devices. And in the meantime, that the device captures much less air, especially from expiratory reserve volume, and reduce the risk also of airway collapse compared to mechanical insufflator. Regarding the clinical evidences, first of all, in patients hospitalized for pulmonary exacerbation, so this small cohort of 21 adult patients hospitalized during 7 days with daily airway clearance therapy with Simeox compared to a control group with conventional chest physiotherapy. The data show that in the Simeox group, walking distance improved significantly and not significantly in the control group. And in the meantime, the symptoms evaluated with the CAT score improved significantly in Simeox group, especially for the 3 domains, dyspnea, cough, and expectoration. That was the first clinical data in patients hospitalized for pulmonary exacerbation. In other cohort of severe COPD patients, the patients received during 6 days daily therapy with Simeox, and this group was compared with a control group with conventional chest physiotherapy. And once again, so the tolerance for Simeox was very good. Patients acquired a quickly autonomy with the Simeox in 15 minutes. And the data show significant improvement of CAT score in Simeox group compared to the control group. In the most severe patients, especially in GOLD 4D of the cohort, the data show a higher significant improvement of FEV1 compared to the control group, and also, in the meantime, a significant improvement of CAT score in this subgroup. It was interesting that there was a subgroup of patients with overlap, with bronchiectasis overlap, and it seemed that this subgroup, in this subgroup, the data was the most beneficial, and probably this is the good target for Simeox therapy. Recently, we were able to conduct a clinical trial with Simeox in a cohort of bronchiectasis patients treated at home during 3 months. And the assumption was that Simeox at home might be an efficient technology in patients, especially who have little access to regular chest physiotherapy. As you know, this is the great concern for these patients. And combined with telecare, it was possible to train remotely the patients to use in autonomy at home, and to perform also regular follow-up with a positive reinforcement during the use of the device. So it was a prospective multi-center study in France, which included 22 patients clinically stable with chronic mucus hypersecretion. And the goal was to check the Simeox adherence after 3 months of therapy, and also to evaluate the feasibility to use telecare to train patients and to perform regular follow-up. So you can see the result there. Adherence of patients treated at home after 3 months was very good. 80% of patients perform more than 3 sessions of Simeox session per week. And this adherence was stable over time during the 3 months of use. We evaluate the quality of life and symptoms with Central Respiratory Questionnaire and CAT score, and we have seen a significant improvement, more than MCID, and also for QLB, especially for the vitality and treatment burden subscore. And the satisfaction of patients was very high, with a rate of 9 on 10 on the visual analogic scales. So in conclusion of this preliminary study, bronchiectasis patients with chronic mucus hypersecretions treated at home have a high level of midterm compliance with Simeox and very high satisfaction for its use coming to telecare. And the results suggest that remote training of Simeox with telecare is feasible for these patients, and that Simeox is safe and effective also in improving airway clearance, symptoms, and quality of life. Of course, this data should be confirmed in a randomized controlled trial, and we plan to conduct a large randomized controlled trial in Europe to confirm this data and to demonstrate efficiency of Simeox in bronchiectasis patients treated at home. Thank you very much for your attention.
So thank you, and we'll have questions at the end. So I would like to invite Dr. Vittoria Comellini to speak about clinical experience sharing.
Thank you for your introduction, and I'm really happy and glad to be here listening and learning from all you experts. And we have just heard about the principle of function of the Simeox, and now I would like to share with you what is my clinical experience as a pulmonologist who take care of non-cystic fibrosis bronchiectasis patients. I'll do it mainly through some few clinical cases, and as you can see, the main theme of the first clinical case is the obstruction. We are talking about a 75-year-old lady. She had smoked a total amount of about 30 packs per year. She's now retired, but she worked as a teacher. She's affected by bronchiectasis with really frequent exacerbations that sometimes lead to hospitalization, mostly due to respiratory failure and pneumonia. Her airways are colonized with Pseudomonas, and speaking about the etiology of her bronchiectasis, probably the history of smoking and the previous recurrent infection plays an important role. Her therapy is a combination of ICS and bronchodilators, as you can see, mucofluidifiers, and long-term azithromycin. She suffers from an important cough. This cough is very insistent and very annoying for the patient. She also presents an extremely dense and viscous mucus that is really, really difficult to eliminate, and she can expectorate only less than 50 milliliters per day of this dense and viscous secretion, sometimes with pneumotized, that is only a rare occasion. She also suffers of an important dyspnea, affecting and limiting her daily activities. And she also has a low body weight, as you can see, 19. Her bronchiectasis severity index shows us that she has an important disease with a high risk of mortality and hospitalization. And as a patient with a chronic hypersecretion of mucus, she was prescribed with an airway clearance technique that was the PEEP bottle, but she refers to us that she performs it only discontinuously. And this is very strange because this patient is like a unicorn. She's one of those patients who usually does exactly what the physician prescribed to her. So it's very strange that she doesn't perform her PEEP bottle. And when we ask her, why don't you perform it regularly every day? She said to us that it's cost a lot of effort to her to perform this chest physiotherapy, and after a few minutes during this exhalation that she performs with the PEP bottle, she feels exhausted, and most than everything, the PEP bottle helps her only a little in eliminating the mucus. So when we are trying to understand why it's so difficult for this patient to eliminate the secretion, we can just think about the density of the mucus, obviously, as she reported to us, but probably we have other factors influencing these difficulties. We can see here her CT scan, and the pathologies is very limited in the upper lobes, where we can find only few cylindrical bronchiectasis, but the situation tends to aggravate towards the lower regions of the lungs. For example, here in the middle lobe and in the lingula, we can observe cylindrical bronchiectasis with more extension. And then in the lower regions of the lung, we can see cystic bronchiectasis with thickening of the bronchial walls and mucus plugging. This, in addition, with her history of smoking, produced a decrease in the FEV1 with a severe obstruction in her airways, about 40% of the predicted values. Moreover, when we performed her a fibrobronchoscopy, we found this excessive dynamic airway collapse, not only here in the trachea, as you can see in the video, but also in the main bronchi. So we have to imagine that her thick and viscous mucus have to come out from her cystic bronchiectasis and travel all along this obstructed and collapsing bronchi to be eliminated. And moreover, the patient probably has also an impaired mucociliary transport. So all of this can cause to her a lot of effort, and it is difficult for her to eliminate the mucus. So we know well that physiotherapy is a pillar of the treatment of this patient, but sometimes we have also to take into account that it can increase the ventilatory load during the session of physiotherapy and fatigue the patient, and especially this if the patient starts with the dyspnea and breathlessness. And so we have to consider this because patients that have an advanced lung disease and frequent hospitalization frequently has low adherence to chest physiotherapy. So what we tried is to prescribe to this patient the Simeox in our clinic, and she was trained by the physiotherapist, and just after one session of treatment made of 3 series of 5 respiratory cycles, the patient perfectly understood how to use the device and became autonomous in using it. The almost passive expiration required by this type of chest physiotherapy was absolutely comfortable and reduced significantly her fatigability and also her premature cough. And since the first application, this patient refers to us that she feels an help in mobilizing and expectorating secretion, thus reducing her bronchial congestion. And what we obtain is an increase, a relevant increase in her daily adherence to chest physiotherapy above 9% after 1 month of use at home. Moving on to the second clinical case, again, as you can see, the main theme here is again the effort of the patient, but we are introducing another issue, which is time. We are talking about a 24-year-old young girl. She's a mom, and she's also a worker. She has never smoked, and she has an history of atopy. She also has, since her birth, an hyperproduction of mucus in the upper airways, especially nose and ears. And she has a chronic Pseudomonas aeruginosa infection with multiple other colonizations. Her therapy is based on long-acting beta-2 agonist, and she had multiple recurrent infection, in one occasion leading to a pneumonia, for what she was hospitalized in the 2016. And as you can see from her CT scan, the most part of the disease is all concentrated in one lobe. In the middle lobe, we can find cystic bronchiectasis and consolidation. And after the treatment of this nocardia pneumonia, she underwent a surgical procedure of lobectomy. But despite of this, she continued to suffer from frequent exacerbations. And more recently, during one of these exacerbations, we took another CT scan for control. And as you can see, she has a lower impact of the disease, a lower damage in her lungs in respect of the first patient. We have here only few cylindrical bronchiectasis, mainly in the lower lobes, here associated with inflammatory infiltrations and consolidation. So we can see from these two examples that bronchiectasis could have a great heterogeneity. And this patient, for example, has a different spirometry. She has a combination of a restricted disease and an obstructive disease with the less severe reduction of the FEV1. However, the impact of the disease on her quality of life and on her symptoms is very high, with chronic productive cough and a really profuse expectoration of more than 200 milliliters per day of purulent and fluid secretion. And so also for this young patient, the bronchiectasis severity index is very high, about 12. She also was prescribed with positive expiratory pressure devices, so many. She tried them, but she always abandoned them. And the reason is because she refers that to eliminate all the secretion that she produces, she needs about more than half an hour every 3 to 4 hours to clear all the secretion that she has in her bronchi. And so, again, we have to consider that adherence to chest physiotherapy in general is very low, above 50% in median, but ranges between 14% to 60%, and it's really dependent on the type of chest physiotherapy and device that we use. And so we have to be very careful when we prescribe one device, and we have to also choose the one that the patient prefers. And poor adherence, we know that obviously leads to poor prognosis and worsen of the outcome of the patient. And lack of time is one of the commonest reasons for not performing the CPTs. Other issues that we have to consider also, because we can potentially intervene on them, is the perceived importance of CPT and understanding of the consequences from non-adherence. And this is really important, especially among young patients. Some patients can also have competence priorities, for example, the work, the sons, as this patient, and also the complexity of use of the device can lead to low adherence. So again, once again, we prescribed to this patient also a Simeox device, and she performed a session with the physiotherapist. She's a young girl, she is smart, and so she learned very quickly how to use the device. And after a short session of one series of 10 respiratory cycles, she can use it almost independently. She found the treatment very simple and, above all, more effective in clearing and sputum, thus reducing the time that you need to perform each session of physiotherapy. And therefore, she was really satisfied and reported a high preference for this device. The passive expiration also in this case reduced her fatigability. And with this young girl, we obtained a great goal, and after 6 months of use at home of this device, her adherence was about 70%. We have just heard about the possibility of prescribing and using this device in the hospital setting in our clinic, but we can use also it for patients in our departments or in our RICU, for example, thanks to the fast learning curve and the reproducibility of the effect, which is mainly dependent from the device itself. it's a potential useful tool also when we have limited resources. For example, a physiotherapist can easily teach a patient how to use this device and then leaving this patient doing his therapy session and take care of other patients, thus improving the possibility of take care of patient when there are limited resources. Moreover, we have just heard about the possibility of use the devices with telecare and telemedicine, and the scientific society are encouraging us, especially after the pandemic, to choose this way to deliver the chest physiotherapy to all the eligible patients. And I'm thinking, for example, of patients who live far away from the hospital or who have impaired mobility. And so we can hear about this also in next presentation by Chiara Beccaluva. So in conclusion, the Simeox device can be a useful tool and should be considered in patients with obstructive disease and chronic productive cough, as it improves the mucus clearance, and drainage session can be performed even in patients with severe disease, avoiding excessive effort. And let me to add that also avoiding the saturation that correlates with great efforts. CPTs with Simeox consist in a supervised exercise training, obviously, but also with self-management strategies. Simeox has no really important side effects, and it's often easy to use. It's well tolerated and shortens the therapy session, and accordingly it can increase satisfaction and adherence of the patient. Simeox allows to have full control over the therapy, and it can be prescribed both in the hospital but also in the outpatient setting, even using the telemedicine. Thank you.
So thank you very much, Vittoria. And the last will be a live demonstration by Miss Chiara Beccaluva from Italy and her patient. And then afterwards, we can have all speakers here on the podium and then take questions.
No, it's not necessary. Thank you. We have a patient here that he comes here with me and say and share with us his experience. Good afternoon. Thank you for this invitation. In the following 50 minutes, I'd provide a demonstration of the Simeox utilization with a real patient. The special guest is Roberto. Roberto is a respiratory patient. He is here with us today. Thank you. And after my talk, we have a cross-talk with him to ask directly his impression of the device. As we already heard by Laurent, Simeox is a 2A medical device for people with lung disease and increasing sputum production. The technology captures little air volumes from the airways by negative pressure with increases intensity at a specific frequencies, with the aim to destructure and mobilize mucus. Negative pressure is intermittent and approximately range from minus 45 to minus 25 millibar. Simeox requires experience of the healthcare professional and can be remotely used by an online platform called Simeox Consult platform. During expiration, the patient inhales from the nose slowly, and during expiration, the Simeox collects air from the lungs, generated intrapulmonary vibration. We can see in this video the effect of the technology. On the right part, the Simeox can liquefy and mobilize mucus from the peripheral airway to the central airway. Now we can introduce a clinical case. Roberto is a man with 73 years old. He's a retired, no-smoker patient. Primary diagnosis is bronchiectasis, and his comorbidity are mitral valve intervention, arterial hypertension, dyslipidemia, BPH, And since 2019, he suffered from recurrent highway infection with multiple antibiotic regimens. And in 2021, he was referred by consultant pulmonology to treatment at home with Simeox. At the baseline assessment, he had the moderate obstruction detected by spirometry, oxygen saturation at rest 95%, and he was prescribed the following drug therapy: antiplatelet agent, antiprostate agent, beta blocker, antihypertensive, and statin. And on lung auscultation, he presented a reduction in vesicular sounds with wheezes. His main reported symptoms were sputum, difficult to mobilize, cough, and low tolerance to vigorous activity. Main CT lung scan findings were right lower lobe thickening in a paravertebral area in a picture of multiple bronchiectasis. At the quality of life evaluation, a low score in domains of physical functioning, health perception, and respiratory symptoms were found. Focusing on physiotherapy, his program was composed of a daily section of Simeox utilization in different positions, in a sitting position on the side. At the beginning, synchronized supervision treatment with respiratory therapist. And from the second month, virtual visit with respiratory therapist every 3 months, and then complementary aerobic exercise training. Now we can see a complete virtual visit added with Simeox treatment with the digital platform.
Good morning, Roberto.
Good morning.
If you are ready, we can start this virtual visit.
Yes, we are ready.
My name is Chiara, your personal respiratory physiotherapist. In a few words, your problem is bronchiectasis with increased sputum production and cough. Your treatment plan includes structured section of Simeox utilization to improve respiratory symptoms. You already received counseling and specific instruction on Simeox utilization. However, if you need further information or if you have a problem with the device, I'm always able for you.
Okay, thank you so much.
Well, we can start. Switch on the machine. Push twice the central button to set program number 3. Set intensity at 100. Connect the remote controller to the machine. Now, you can move to the correct position for the treatment, on the right side. Breathe slowly with inspiration by nose and expiration by mouth. During expiration, push the controller to activate Simeox technology. Repeat the treatment 10 times. You should control the correct activation of the machine. You need to be sure that at least 2 of 5 lights are on.
Please note the activation of the remote controller during expiration. The expiration is slowly. We can see the activation of the device and the number of the expiration during the session. We can see the level of the performance. We can see the last 2 expiration. And you can see something maybe wrong.
Now, you can move to the sitting position to have cough. proceed the treatment section. Now I need the following information by you to check section validity. Have you any problems with the utilization of the device?
No, not at all.
Did you feel any symptoms?
Not particularly.
Was the minimal activation of two lights reached in all cycles?
Yeah, every time.
Have you ever seen also red lines?
Yeah, at the end I saw red lights flashing.
Roberto, you should control the correct position of the tongue, because the problem could be the obstruction of the mouthpiece of the machine. The tongue should be placed under the mouthpiece.
Okay, I got the point. Thank you.
I remember you that according your treatment plan, the next synchronized session will be on Monday.
Mm-hmm.
It's important for you also to have a 2-day rest every week.
Okay, thank you so much. Thank you.
Well, okay, Roberto, see you on Monday. Bye.
Bye-bye, thank you.
Thank you, Roberto. Now we can see the follow-up period. Main data during follow-up assessment was as we can follow. It improved in forced expiratory volume the first second, oxygen saturation at rest. He didn't have exacerbation during the last year. He didn't use bronchodilators, steroids, antibiotics, or oxygen. And he presented on lung auscultation vesicular sound without wheezes. And also his reporting symptoms improved. He reduced the quantity of sputum. For Roberto was more easy mobilize. He reduced cough, and he improved his tolerance, his exercise tolerance. At quality of life evaluation, the score in all domains improved, in particular in physical functioning, health perception and respiratory symptoms. And finally, in CT lung scan, the pulmonary thickening reporting in a right lower lobe in a paravertebral area can no longer be documented. Now, I asked Roberto to come here and to share with us his experience with the device.
Good afternoon. I'm a patient of yours. Touch me if you like. I'm real. Thank you for the opportunity you are giving me. But I want to thank Chiara for this exciting moment of my life. I'm 73. I've been a C-level manager up to 5 years ago. No smoking, never smoked in my life. Nevertheless, I'm here to talk about bronchiectasis. I had a good physical shape up to around 10 years ago. I used to run for 1 hour a day. And after they found bronchiectasis, the life started becoming in a better shape, definitely. Not just for physical issue, but for mental issue. I start to think that my life should become shorter and shorter. Statistically speaking, I have another 13 years of life. I should live, keep finger crossed, up to 86, except some accident which during my life could happen. So 6 or 5 years ago, my life started changing. 18 months ago, my pneumologist found definitely the reason of my sickness and found avium. Maybe you are familiar with the concept. I was not familiar at all. I started reading internet. I found every type of how can you say, potential accident. The pneumologist didn't suggest me any specific therapy except physiotherapy. She introduced me Chiara, and Chiara clearly changed my life. She came at home with a small box and said, breathe in as more frequently as you can. I start doing that, and my life start improving. Today, I have some cough for a couple of months a year, during winter time mainly, but I used to practice this machine every day for around between 20 and 30 minutes each session. I practice cyclette at home for around 30 minutes a day, plus between 5,000 and 7,000 steps a day, depending on winter time. The life has changed, but again, what has changed mostly was the mental shape. I start thinking that I could have another longer step of my life in front of me, and that's real. I'm more positive. I have more strength. Even if in the last 10 years I've lost weight around 8 kilos. When I was in a good shape, when I was around 50, my weight was around 98. Now it is 92. I think to have lost the vast majority of muscle mass. Frankly speaking, I think is a question of age mainly. So the machine I'm using is easy to use, robust. I was a bit skeptic. I thought about mechanical ventilator, oxygen mask, but at the end of the day, it's just a simple box with a tube, and I need to breathe inside. So it's good. It's definitely positive. The challenge is again in my mind. So setting a specific timing every day for practice correct. This is, I think, the secret. The rest is, I wouldn't say, is not really silent. This is the critics I can provide to the machine, but the rest is really positive. Over or can go home?
I think maybe we can take some questions for Roberto or for the other speakers. We have time for maybe a couple of questions, and maybe the speakers would like to go on stage and answer also the questions. So thank you very much.
Okay.
And you're
Pleasure.
welcome to stay with the panel.
Okay.
And we'll have the first question, please.
Yeah, I have a question to each speaker. The first one to Laurent. An improvement in the CAT score, which is 0 to 40, and you had a mean improvement 34, which is unbelievable. Below 10, the patient is as good as symptom-free. So probably it was not CAT, it was probably SGRQ on your slide. I don't know, but it is also true for the improvement, the minimal clinically important difference of 4, which is for SGRQ and not for CAT. The second question is to Vittoria. Your second patient was, for my mind, purely restrictive and not a mixed pattern, because we don't have total lung capacity that we can say it is obstructive, but you had a FEV1 FVC ratio of 91, and you had a completely normal but small full volume curve, and it is not an obstructive pattern. And the last question is to Chiara. A patient with manifest obstruction, probably the treatment could be even more effective successful if you would give a long active bronchodilator treatment. I think you had 56% of FEV1, or it was the ratio. Why you don't give a bronchodilator?
Yeah, so Laurent, do you want to start with?
Yes, for the values of improvement, you were talking about the home care study.
Yeah, but you did show CAT score improvement 34 in the treatment group.
Yeah, so I would check the value, but yeah, thank you.
Yeah.
So thank you for your comments. And for sure, the patient has a restricted disease, probably because she underwent the surgical procedure of lobectomy. But we can find also an obstruction in the little airways. And this is mainly because she has this little bronchiectasis, few little bronchiectasis, it is correct. And we can see a little damage here in the airways and in the lungs, but with a great impact and symptoms that really are accordingly with the diagnosis of bronchiectasis.
Yeah, so we often see the pattern of a preserved ratio impaired spirometry in patients with bronchiectasis, so I'm not surprised by this.
Thank you for the question. I think that is a good idea, maybe use the bronchodilators, but in this case, the pulmonologist didn't prescribe the therapy.
Okay, and last question, Arietta.
Yes, thank you all for your presentations. Arietta Spinu from King's College London. And many thanks to Roberto for coming and sharing his experience. I think what you actually did is that you shared your experience very nicely about how a patient who is adherent to airway clearance techniques and does physical activity / exercise can improve massively in the outcome. So it's very important to keep that in our mind. I have a question for the other speakers about adherence. So does the machine measure adherence? How do you assess that in your studies?
So we evaluate adherence by two means. The first one was a diary card completed by the patient himself at home. And the second one, it was the device transferred automatically the data via a server. So we have the. I did not show the data because we have no time today. But there was a correlation between the self adherence and data transferred on the web.
Yeah. Yes, thank you. So it's important that we have the data from the machine as well. My comment would be that if I call my patients every 10 days, I don't know if you've done the same thing in your study, they will remember to do that, and probably they will be more willing to do airway clearance. So it would be interesting to see data when you don't have this intensive follow-up with your patients. So that's one of the comments. And then with regards to the clinical cases you've demonstrated, I was quite interested in the first one because it was a quite severe patient with fatigue. And I was thinking about the bubble PEP that she was originally using. And I think that was probably, anyway, not appropriate for her because we know that for us to use positive expiratory pressure devices, our patient needs to have the ability to create enough pressure to activate the devices. In this case, you didn't have a device, but you had a homemade device, but it's the same principle. So I'm not very surprised that she didn't follow that because she wasn't able, and we usually wouldn't go for that. And I was thinking, did you have any data about the peak flow of this patient? and about expiratory pressures.
No, I'm sorry, but with lack of this data, it would be really interesting to evaluate that. And probably, as Laurent showed us, the almost passive and relaxed expiration is something that she could achieve better than performing a forced expiration to do the chest physiotherapy with the bottle.
Yeah, so I'm sorry, but we're running out of time. So thank you to all of the speakers for a very interesting session, and thank you to PhysioAssist